Diabetes is a widespread chronic health condition where the body's ability to process blood glucose, commonly known as blood sugar, is impaired. Type 1 diabetes, often diagnosed in children and young adults, is an autoimmune condition where the body's immune system mistakenly attacks and destroys insulin producing cells in the pancreas. With type 2 diabetes, more common in adults, either the body doesn't produce enough insulin or it resists insulin's effects, often related to lifestyle factors and genetics. Treatment for diabetes varies. Type 1 requires regular insulin injections, while type 2 may be managed with lifestyle changes, oral medications, and sometimes insulin. Risk factors for type 1 include family history and genetics, whereas type 2 is associated with obesity, inactivity, and family history. Here's a closer look at the nuanced aspects of these two forms of diabetes. Onset age, juvenile versus adult. Understanding the age of onset for diabetes is pivotal in distinguishing between type 1 and type 2 diabetes. Type 1 diabetes is often diagnosed in children and young adults and is historically referred to as juvenile diabetes due to its early appearance. The body's immune system mistakenly attacks the insulin-producing cells in the pancreas, leading to insulin deficiency. Conversely, type 2 diabetes is more prevalent in adults and is associated with insulin resistance, where the body's cells do not respond effectively to insulin. Over time, it can develop due to a combination of lifestyle factors and genetic predisposition. While type 2 can also occur in younger individuals, the age of onset plays a significant role in the initial consideration of the type of diabetes during diagnosis. Primary deficit: insulin production versus insulin resistance. In differentiating between type 1 and type 2 diabetes, the primary deficit plays a pivotal role. Type 1 diabetes is characterized by an autoimmune response, where the body's immune system mistakenly targets and destroys pancreatic beta cells, leading to an absolute deficiency in insulin production. Consequently, patients require lifelong insulin therapy. Conversely, type 2 diabetes primarily involves insulin resistance, a condition wherein the body's cells fail to respond effectively to insulin, coupled with an eventual decline in insulin production. Lifestyle factors, including obesity and physical inactivity, significantly contribute to the development of type 2 diabetes. Management often starts with dietary changes and exercise, progressing to medications that improve insulin sensitivity or secretion, with insulin therapy introduced as the disease advances. Body weight influence: often thin versus often obese. Individuals with type 1 diabetes are often thin or at a normal weight at the time of diagnosis, as this autoimmune disease can develop rapidly and the body's inability to produce insulin leads to significant weight loss before management. In contrast, type 2 diabetes is frequently associated with obesity or being overweight, stemming from a combination of insulin resistance and inadequate insulin production. Excess body weight, particularly around the abdomen, increases the risk of developing insulin resistance, which is a hallmark of type 2 diabetes. Consequently, body weight and body mass index, BMI, can be strong indicators in differentiating between the two types during diagnosis. Managing body weight through diet and exercise is also a critical component in the treatment and management of type 2 diabetes, unlike type 1, which primarily requires insulin replacement therapy. Autoimmune aspect: autoimmune destruction versus metabolic syndrome. Type 1 diabetes is characterized by the autoimmune destruction of insulin-producing beta cells in the pancreas, leading to insulin deficiency. It often manifests in childhood or adolescence and necessitates lifelong insulin replacement therapy. Genetic predisposition and environmental triggers contribute to this autoimmune attack, which is not related to lifestyle factors. Contrarily, type 2 diabetes arises from a combination of insulin resistance and insufficient insulin secretion, typically associated with metabolic syndrome. Lifestyle factors like obesity, poor diet, and lack of exercise play a significant role in its development. Adults are more commonly diagnosed with type 2 diabetes, though it is increasingly seen in younger individuals due to rising obesity rates. Management includes lifestyle modification, oral medications, and sometimes insulin. Management dependence: insulin dependent versus diet oral medications controlled. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks insulin producing beta cells, leading to insulin deficiency. Consequently, individuals with type 1 diabetes are insulin dependent for life, requiring regular insulin injections to control blood glucose levels. In contrast, type 2 diabetes is linked to insulin resistance and often associated with lifestyle factors. Management of type 2 diabetes typically starts with diet and exercise. However, as the disease progresses, oral medications may be necessary to improve insulin sensitivity or stimulate insulin production. In some cases, if these measures become insufficient, individuals with type 2 diabetes may also become insulin dependent.